Hi there everyone. I thought our video this week would be about the common misconceptions about tooth whitening. There's always a ton of information on Facebook and people are always sharing stories about how to get whiter, brighter smile, and now that summertime everyone really wants that really nice bright white smile, so I thought we would go over a couple of the most common misconceptions about whitening that people have. So we'll just get started off. So the first most common misconception about tooth whitening is that you can get effective whitening with toothpaste and whitening mouth rinses. Now, those toothpaste and mouth rinses can be effective at removing some surface stain. So if you drink some coffee, red wine, eat a lot of curry, things like that that cause the surface stains on your teeth, it can help remove some of those, but it doesn't really penetrate into the tooth to brighten the tooth itself. So it does good maybe to get you a shade or two whiter, but it's not going to get that effective whitening that really the advertisements want you to think that it's going to get. And so then the second most common misconception that people seem to have is that you can still whiten your crowns, your veneers, your tooth colored fillings, and that is in fact false. So the color of the filling, the crown that we put in, is the color it's going to be. The whitening agents that we have to whiten teeth don't work on the same materials that we use to restore your teeth. So especially if you're considering getting fillings or veneers on your front teeth for cosmetic reasons, it's definitely recommended to whiten and get to whatever shade you desire before proceeding with those cosmetic treatments. Now, if you're getting those fillings because you have a cavity or you broke your tooth or something, then we'll do our best to match the shade that you're currently at. But just keep in mind, if you want to bleach drastically down the road, those fillings, veneers, crowns might not match as well as they did initially. So then the third most common misconception is that you can use natural remedies like I've heard strawberries to whiten your teeth. People will rub strawberries on their teeth or puree the strawberries and rub it on their teeth. And so I looked into that. So there is a little bit of merit to the specific acid that is in strawberries, but it's kind of at the detriment that the acid erodes your enamel. So it's not healthy for your teeth, so you might look a little bit whiter and brighter, but once you take away that good healthy enamel, you take away the strength of that tooth, and then you also make yourself more prone to cavities. So I would just not rub strawberries on your teeth. That's my recommendation, is just to not do it. So then the fourth most common misconception about tooth whitening is once you bleach and get to the shade that you like, you'll never have to bleach again. And unfortunately, that is not the case. So there is some rebound effect. So once you get to that bright white smile, your smile will darken just a little bit, and that's just naturally that happens. But also, as time progresses, your teeth get older, and older teeth tend to have a more yellow hue to them. But also, you're gonna keep up with the same habits that kind of yellowed those teeth in the first place. So if you drink a lot of coffee, drink a lot of wine. So I know I mentioned earlier that those are surface stains, but if you have a heavy coffee or wine habit or just a prolonged coffee or wine habit, it penetrates deeper than what can be removed just by surface removal. So as you continue those habits, you're going to have some rebounding in your color as well. So you don't have to necessarily go through the extensive whitening treatment you go through initially, but you'll still have to do a touch-up every 6 months, every year. It really just depends. Everyone's tooth responds differently. Some people seem to be a little bit more resistant to staining based on their habits and the quality of their tooth enamel, but there's definitely still some touch-up that is needed to maintain the shade that you like. And the last most common misconception is that all whitening is the same. So there's a ton of products out there. So you can do over-the-counter, the Crest White strips. There's bleaching that is dispensed from a dentist, but you take it home. And then there's in-office whitening. So all of them serve their own purpose because they are uniquely different. So it really is a decision we can discuss, and based off of your needs. The stronger formulas tend to work not only quicker but a little bit deeper. So, if you're in a rush, you have a wedding in 2 weeks, and you realize, oh gosh darn it, I really want to have white teeth, we might look into a more aggressive in-office treatment. But if you're just looking to get a brighter smile, but you don't have a definitive timeline, it's only a couple shades, then something over the counter might be suitable for you. So just because we have the in-office treatments, it's not always the right treatment for you. So we have tons of different options to get you to the shade that you desire. So that was kind of a quick rundown of the top 5 biggest misconceptions about tooth whitening. So if you guys have any additional questions, if something I said wasn't clear, please just let me know if you need any more clarification on anything, and if you have any other questions that you'd like me to do in the next video. All right, you guys have a good day.